So I am extremely happy to say that in our center we will have treatment for all surgical issues pertaining to the abdomen, GI surgery, minimally invasive or laparoscopic surgery, to an extent abdominal cancer surgery as well. Now this is actually a very broad spectrum, as I would say, but I would just try to tell you in a nutshell. Now what all we are treating? We are treating the commonest things like appendicitis or appendicectomies, laparoscopic gallbladder surgery, laparoscopic hiatal hernia surgery, which is very popular now for acidity problem. There are a few laparoscopic surgeries which are specifically, say for example in gynec surgery we have some ovarian issues and things like that. We have laparoscopic surgery for intra-abdominal adhesions. A patient can have multiple operations earlier and then come back to us with pain wherein adhesions or sticking of the bowel loops inside is the causative agent, and then a laparoscopic surgery is wonderful to do that. We are also doing laparoscopy and open surgery for various kinds of hernias like inguinal hernia, umbilical hernias, lumbar hernias, incisional hernias, etc. Of course, the modality and choice whether we do it laparoscopically or open surgery, it depends on multiple factors like how many operations the patient has undergone, what is his or her underlying comorbidities, which kind of anesthesia they are going to tolerate, etc., etc. We also cater to colorectal surgery, in the sense diseases of colon, rectum and anal canal, starting from the commonest problems like say piles, fissures, fistulas, Crohn's disease, ulcerative colitis, cancers of the small and large bowel. So this is another part which we are absolutely efficient in handling. Apart from that, our specialization is in hepatobiliary and pancreatic surgeries. Now, what is hepatobiliary surgery? It is not just confined to a gallbladder operation. Hepatobiliary surgery includes gallbladder surgery for stones, tumors or malignancies, bile duct cancers or other anomalies of bile duct, plus hepatic tumors or liver tumors, tumors arising from the bile duct, etc., etc. We regularly cater to surgery for acute pancreatitis, which can include drainage of pancreatic abscesses, pancreatic necrosectomies. We do a variety of operations for what we call as chronic pancreatitis, which again has got diverse number of procedures. We are dealing with resections of liver, we are dealing with resections of pancreas, stomach cancers and esophageal cancers. So in short, what I am telling you, in addition to that, we deal with something called as surgical intervention for bad portal hypertension, wherein a patient has had upper GI bleed, there is bleeding through vomiting, and an endoscopic treatment for some or other reason multiple times has failed, and or there are issues with the spleen wherein a surgeon has to come in. So this is called as surgery for portal hypertension. It is popularly also called as a non-shunt surgery or a shunt surgery. So these are all the spectra, what we deal with. And there are certain number of patients where we have offered them surgery for morbid obesity also. And now, as everyone knows, there are a lot of modalities to treat obesity through endoscopic treatments and various other things. So keeping up with the time, giving the best possible options and the best possible treatment and results at a very, very competitive pricing is what we try and do at calls. So my idea about starting this center and running it successfully has been early diagnosis, quick assessment and quick treatment, so that my patient goes back to his or her routine at the earliest. When this is being done, we judiciously take interest and look into the cost effectiveness of the procedure, the cost factors which are solely dependent on the hospital as well as the cost factors outside. So we try and help the patient out financially. Not I am telling you by doing something free or something, but yes, definitely competitively reducing the price and helping the patient out. A slow or a low hospital stay, the number of days a patient stays in our center is very less. They go back home early, and that also adds in reducing the cost of the treatment as well as patient's overall expenditure. Say for example, a patient has come to us outside the city, from outside the state. Then they have limited days on their hand. They can't lose work. And then at that time, this kind of a comprehensive approach actually helps the patient. And we have many such patients who have come outside the state of Telangana, who come here for treatment, and they actually go back as per their schedule. So, in short, I would say good and quick diagnosis, correct line of treatment, less or minimal hospital stay, controlling the expenditures, and the most important aspect, post-surgery or post-treatment follow-up. Each and every patient after the procedure is judiciously followed. If a patient forgets or is not able to come back for a time, our front desk people or my staff, they contact the patient upfront, they inquire, they check about the well-being of the patient, they gently remind them that so and so is the date when they were supposed to come. They are supposed to come back with certain tests and investigations, again cutting their time off. So a clarity about post-operative treatment, very judicious follow-up, and when all this is being done, it has to be done, and it is done in a friendly and patient-compliant atmosphere. I think whatever good work we have been able to do, it is thanks to our patients. There are no words to express my gratitude to them, and of course my team, which has singularly followed the principles what I envisage for the treatment. I look forward, and I would be very happy to share my experience and expertise with any or all of the needy patients, and I assure you that what I have discussed earlier in this video, you will actually experience it. Thank you very much.